Hello, my name is Dr. Linda Smith, and for the past 25 years I've been diagnosing and treating women with breast cancer. In this video, I will give you an overview of the tests which are used to diagnose breast cancer and general information about the treatment options that are available today. A screening test, such as a yearly mammogram, is given routinely to people who appear to be healthy and are not suspected of having breast cancer. Mammography is the process of using low-energy X-rays to examine the human breast and is used as a diagnostic and screening tool. The goal of mammography is the early detection of breast cancer before any symptoms can develop, and the cancer usually is easiest to treat. A diagnostic test such as a biopsy is given to people who are suspected of having breast cancer, either because of symptoms they may be experiencing or a screening test result. Diagnostic tests are used to determine whether or not breast cancer is present, and if so, whether or not it has traveled outside the breast. Diagnostic tests are also used to gather more information about the cancer to guide decisions about the treatment. Once breast cancer is diagnosed, many tests are used during and after treatment to monitor how well therapies are working. Monitoring tests also may be used to check for any other signs of recurrence. A breast self-examination should be part of your monthly health care routine, and you should visit your doctor if you notice any change in your breasts. If you're over 40 or at a high risk for the disease, you should also have an annual mammogram and physical examination by a doctor. The earlier breast cancer is found and diagnosed, the better your chances of beating it. There are many different types of treatment for patients with breast cancer. Some treatments are standard and some are being tested in clinical trials. Because treatment of breast cancer is uniquely tailored for each patient, your doctor may have reasons for suggesting a treatment plan different from what most professionals regard as a general treatment option. There are 6 types of standard treatment. Surgery, radiation therapy, chemotherapy, hormone therapy, and targeted therapy are all common types of treatment. Most patients with breast cancer have surgery to remove the cancer from the breast. Breast-conserving surgery is an operation to remove the cancer, but not the breast itself. A lumpectomy or partial mastectomy is a surgery to remove a tumor or a lump and a small amount of normal tissue around it. Chemotherapy is a cancer treatment that uses drugs to stop growth of cancer cells, either by killing the cells or by stopping them from dividing. Hormone therapy is a cancer treatment that removes hormones or blocks their action and stops cancer cells from growing. Radiation therapy is a cancer treatment that uses high-energy X-ray or other types of radiation to kill cancer cells or keep them from growing. Many of today's standard treatments for cancer are based on earlier clinical trials. And there are new types of treatments that are being tested in clinical trials. A clinical trial is a research study meant to help improve current treatments or obtain information on new treatments for patients with cancer, and is part of the cancer research process. Clinical trials are done to find out if new cancer treatments are safe and effective or better than the standard treatment. The advancement in breast cancer treatment and therapies over the past decade are extraordinary. The most important step in the whole process is to be able to have tests regularly, and if you have questions, please talk to your physician. Thank you for watching. This video was created to provide information about breast cancer treatment and is not a substitute for medical advice. If you have a question, please talk to your physician.